Hi, everybody. This is Penny Hunsaker, Senior Health Coach with American Health and Wellness Group. And today, in response to COVID-19 and keeping everybody healthy, we would like to share with our clients an interview that I'm having today with Jamesy Thomas. Now, Jamesy is a smoking cessation specialist with the Marion County Public Health Department, and he's also a prior smoker, right, Jamesy?
Yes, I am.
So he can relate on many levels. Now, the first question I had, Jamesy, that I was surprised about is that you referred to Indiana as Tobacco Nation. What did you mean by that?
Well, if you look from essentially Michigan all the way down to the Gulf Coast, like Mississippi, Alabama, include Kentucky, Tennessee, and also North Carolina and Arkansas, we're essentially what some researchers call Tobacco Nation. Our smoking rates are just so much higher than the rest of the country. And actually, if we carve out those states and compare them at the national level to other countries, we're, I believe, the sixth highest region for smokers.
So then what I hear you saying, if we're the sixth highest region for smokers, then should people who smoke or use e-cigarettes be concerned about the COVID-19 virus?
Yes, 100% yes. The CDC has studied the impact tobacco has on individuals and respiratory illnesses. Smoking damages your lungs and leaves them unable to fend off infections. This makes smokers more likely to develop upper respiratory infections and can make those illnesses last longer with more severe symptoms. There are very few studies on e-cigarettes and respiratory illnesses, just because those are new products and we haven't had the time to do long-term studies on them. We know that the vapor, quote unquote, the vapor is actually an aerosol which contains ultrafine particles and at least 70 cancer-causing chemicals that can damage your lungs. We haven't had time to do a lot of studies on COVID and smoking, but if COVID is a respiratory illness, we should err on the side of safety.
If you are a smoker or e-cigarette user and you have families inside the house, is it important? I mean, I would imagine it would be important to not smoke around them for the same reason.
Yeah, secondhand and thirdhand smoke will also cause a lot of these issues too as well. So protect those around us.
Great. So if I am a smoker or an e-cigarette user and I'm worried about being a high risk for COVID-19, what do you recommend?
I recommend now is the time to quit. If you want to support our frontline healthcare providers, if you want to help protect those you live with and are close to, quitting tobacco is that extra step that you can take to prevent the spread of the disease. And by doing so, you can hopefully reduce COVID cases in your community, which means there's less patients for healthcare providers to care for.
That's great. Now, so what can we do? What can we provide for those that are now thinking about this might be a good time for me to quit?
If you're serious about quitting, the best thing you can do is call the 1-800-QUIT-NOW hotline. They'll send you a packet of information. They'll set up 4 counseling sessions. And if you qualify, which right now pretty much everyone qualifies, if you qualify for it, you'll receive free nicotine replacement therapy. So the patch, lozenges, or the gum. The quit coaches that are on that staff, they have 200 to 250 hours of training, and many of them, over half of them, are ex-smokers, and so they know what you're going through. They understand the addiction. They understand triggers. They understand how to do it during stressful times, and so you really have someone on your side when you call them. And you can call anytime you want, and you can do two quit attempts per year. But you are free to just call in and talk to someone anytime, 24/7, any day of the week.
Thank you, Jamesy. I've really appreciated this interview. And if any of you out there are interested in even thinking about it, I think it's important to take that first step and call 1-800-QUIT-NOW, even just for a brief counseling session to see what you need to do to get ready to quit. Jamesy, is there anything else you'd like to add?
I would just like to add that I know times are stressful. Stress is a huge trigger when you quit. It's a huge trigger even after you have successfully quit. And so trying to be an ex-smoker, it really helps to identify those triggers and what makes them things stressful and try to replace them with those healthy habits.
Great. Well, you're a wonderful resource. I appreciate you sharing your expertise with us. And I hope that you and your family stay well during this time.
Thank you. You too.
Thank you. I'll talk to you again soon.
Thank you.